The thought that tension is a problem in and of itself. Tension is a strategy. Tension is your body creating stiffness. In order to effectively reduce tension in a muscle, you can attack it with treatment, or you can create an alternate path for stability. When we take out tension without applying alternative pathways for movement, you create additional problems. I know some people do that as a means of just getting temporary relief, but this can't be your life forever. Oftentimes within my practice style, we are not stripping muscle tension away until we've created an alternate pathway utilizing tension and movement so that we have this kind of transitioning of strategy. Welcome to the Doc Wishloff podcast. I am your host, Dr. Kirsten Wishloff. On today's episode, we are talking about dynamic ergonomics, making sure you feel good at the workplace. So in the past, 3 to 5 years, I've fallen into the world of ergonomics, mostly through seeing clients for some sort of like athletic-based injury, and then starting to recognize that a lot of it is coming from their positions at their workplace, which has kind of led me to just like into the workplace in general. I just wrapped up a chat with the Alberta Dental Association, chatting with their dentists and dental hygienists about how we can create better strategies in our body and how we can use our body to improve our health outside of work. And that's really what's important for me, is being sure that, yes, we want to be more efficient at work. Yes, we want to be able to work, longer hours without pain or whatever the case is, but you have a body outside of work, and we want to make sure that that body is not getting hurt in work and ultimately influencing your life outside of the office, because that sucks, right? If you go through a day at work and then there's pain in your body that is starting to accumulate and disrupt what you're actually able to do outside of work, that's where the line gets drawn for me, and where I start to step in and go, why are there these ergonomic injuries, and what can I do to help you guys get out of them? So on today's episode, I'm going to talk about strategy for ergonomics and how we can kind of take a little bit of a different approach to start to view these problems as problems of performance, problems of force control, instead of just seeing them as passive. So I use the term dynamic ergonomics because the approach that I'm taking isn't just about stacking everything into a neutral and hoping for the best. It's about purposefully creating force in your body so that you are in control of where this motion flows. Once we can bring awareness of how we create tension in our body, suddenly we're the driver in terms of what is actually getting sore at the end of the day. Most of the time when we're thinking ergonomics, we think about stacking everything into neutrals. So stack your spine neutral and push your feet down at 90 degrees and get your elbows at 90 degrees and everything is perfect. Never move and you will never get an injury. If you're listening to this and you've done that and you still have injuries, don't worry. That's because that's not true. So holding yourself into neutral positions gives your joint capsules a little bit of a break. So your joint capsules are happy when they're not totally crammed one way or the other. So good starting point. What a neutral position also does, and that is maybe not mentioned enough, it creates even leverage and optimizes that strength of a muscle. So every muscle in your body has an opposing muscle, biceps and triceps, one side of your lower back, the other side of your lower back. There's all these opposing groups because when you shorten a muscle, you need another muscle to get it long again, or else you need to kind of passively get it there. But we now, in a neutral position, have made it equal for the eccentric and concentric sides of a joint movement to happen. So yes, the neutral position is a great place to start, but now we have to use the muscles, right? We have to utilize this neutral position to actually create tension so that we control the flow of force in our body. The first and most important thing that you can do to alleviate postural stress is breathe effectively. If you are using a strategy to breathe that involves lifting your rib cage up and down, you are going to get a lot of lower back stress. You're going to get a lot of stress in your neck. This is absolutely the number one reason why I see people for lower back or neck pain within workplace environments is an inability to efficiently use your breathing muscles to breathe. So you start using your stabilizing muscles to breathe. The muscles that are stabilizing and controlling the position of your spine are now being used as a compensation mechanism to create breath. So if you are just listening to this and you're not watching the video, I want you to imagine kind of your rib cage in space. If we can't drop our diaphragm down, the diaphragm is kind of an umbrella-shaped muscle that lives under your rib cage. In order to breathe, your diaphragm drops down, your pelvic floor should also drop down, so we create space in your abdominal cavity to breathe. If you can't drop your diaphragm down or you have tightness on the posterior side of your diaphragm, the alternate strategy your body uses is to pick your ribs up to create space. The muscles that pick your ribs up to create space are your pec minor and your scalenes. Those are the muscles that get used to pick up your rib cage. At the back, what ends up happening if we're picking the rib cage up in the front, in order to do that more efficiently, your lower back muscles, like your QLs, those guys get really sore on the sides of your lower back, those guys pull down. So we have this pulling up in the muscles of the front of your neck and chest, and we have this pulling down of the muscles in your back. These muscles are doing your breathing, and so they're not doing a great job of stabilizing your spine. Yeah? Every time you flow a cycle of breath, those muscles get a little pump in them. They're having to work, and they also have to change their duties. So they're not doing a great job of creating stability in your neck. They're not doing a great job of creating stability in your lumbar spine. They're doing kind of 500,000 jobs and getting really, really tired. If you are someone experiencing tightness on the sides of your neck, tightness in your jaw, tightness in your lower back, especially after a long workday, the first thing you are going to want to address is your capacity to breathe. This gets worsened through the day because you kind of start to melt into your chair. We start to lose that stiffness. When we exercise, when we move, we reset the tone, we reset the stiffness. The longer we smoosh into the same position, we lose all this tension. And so suddenly we've kind of lost our ability to hold ourselves upright, and we start to lean into more of like a rib cage dominant strategy because we can't drop the pelvic floor down because we're all compressed through the midline. So if you're listening to this and you're experiencing postural pain, the very first thing I want you to do is start to take a look at your breath patterns. How can we do that? If you're just watching, or if you're watching on YouTube, amazing. If you're not, what I'm doing is just sitting, and then I'm going to put my hands on either side of my neck and take a breath. As you do that breath, is there a change in the tone of your neck muscles? To breathe in, does your neck have to tighten up and then relax? If yes, that's an indication you are using your neck muscles to breathe. There should not be a change in the tone of your neck muscles to take a breath. That is a compensation strategy that is going to lead to a lot of problems down the line. But from the outside looking in, you'll look like you're really straight up and down, and everyone will say you have really good posture. But you're using your neck to breathe as a problem. So that's really like a little takeaway, little snippety snap. Number one is that breathing pattern is going to be really important for stress in the lower back and the neck. And it's often really an underutilized strategy to adjust a lot of neck pain, headaches, etc. Once we get our breathing in check, we really want to start to look at strategy. So it's not, again, just about that 90 degrees. We want to start to look at how your body is actually creating these positions. From the outside looking in, two people's postures could look the exact same. I work with a lot of violinists. They could be looking the exact same from the outside, but they could be experiencing two very different sets of injuries. This is because strategy is different than position. From the outside looking in, things can look the same, but when we start to break that down and bring a little bit of movement, and we start to address where your body can create tension and where it is missing tension, we start to find gaps in stability in different people. Really good examples of this is people with old injuries. If you hurt your ankle, if you had an ACL surgery, if you had some sort of abdominal surgery, suddenly the way your body transmits force up the system is changed. If you can't pressurize one side of your body and your foot into the ground or into the chair as effectively as the other side, it starts to show up in asymmetries in how your upper body can create force and the starting position that it can actually utilize. So although we often categorize injuries at the location of the pain, that's not necessarily where the treatment plan lives. I would love to tell you that every single person is going to benefit from a carpal tunnel treatment plan at their hand, maybe even up to their shoulder. But some people with carpal tunnel might benefit from a lower back rehab plan, right? If you are not using your arm efficiently, or if you're overusing your arm because of an inability to create stiffness and tension at your core because of pre-existing back injury, the carpal tunnel treatment plan might actually be a lower back rehab plan or a foot pressure rehab plan or whatever the case is. So we want to get comfortable in, yes, I can appreciate that you want to relieve the site of pain. we have lots of strategies to do that. We want to make sure that we're mapping out a plan to resolve or adjust the mechanism that's creating that pain. That is higher up on the priority list, and ultimately much harder to find someone who is effective at doing that within a practice style, because unfortunately that's just not the way injuries are taught in classic education surrounding diagnosis of pain and injury. So that's something that I really emphasize within my own style of practice. If you're listening to this podcast and you like my practice style or you're interested in my approach, we're not starting from the site of pain. We're starting from the site of pain insofar that we're looking at why that area is becoming so overused, especially when we're talking about these postural injuries that are not based in a trauma. We're not getting hit by, a bat or something, and then you're like, oh, the bat caused that injury. It's like your foot isn't working, so that creates this cascade. We have to map out the cascade of what's happening and start to peel this down layer by layer. We don't want to be in a rush to strip tension out of your body. This is a bit of a controversial take, because I know a lot of the time when you go for treatment, this thought is like, oh, everything's really tight. Ooh, these are really tight. Like I imagine, the weird uncle coming up behind you and like massaging your shoulder and being like, ooh, you're holding a lot of tension. Like, get off me. The thought that tension is a problem in and of itself. Tension is a strategy. Tension is your body creating stiffness. In order to effectively reduce tension in a muscle, you can attack it with treatment, or you can create an alternate path for stability. Tension that is coming secondary to your body needing to create stiffness and stability that is stripped away opens you up and exposes you for issues of instability, right? So when we take out tension without applying alternative pathways for movement, you create additional problems. So oftentimes within my practice style, we are not stripping muscle tension away until we've created an alternate pathway utilizing tension and movement, so that we have this kind of transitioning of strategy. We don't just want to continue to strip out muscle tension aimlessly. I know some people do that as a means of just getting temporary relief. Happens to the best of us. Go for a couple treatments, but this can't be your life forever. Yeah? Like we can't continue down this path of just like the same muscles getting super jacked up, temporary relief, 2 days later, back to jacked up. Like this back and forth is so exhausting, and it's really unfortunate that that's how people perceive to use treatment. I know that that's what it seems like. Like, this is sore, this is tight, I'm going to go get a miracle cure and then exist in my life normally. It's a tension strategy. Your body is creating tension in that area to create some sort of support that it is needing and is not getting from somewhere else. So the purpose of exercise isn't exclusively to strengthen the site that has been injured. That's one strategy. But really what the strategy should be is to optimize the flow of movement somewhere else so that the area that continues to get tight and painful doesn't have to keep getting tight and painful. So when we're talking about someone who always has tight upper traps, we're looking immediately at like pelvic floor. We're looking at lower abdominals. We're looking at lower back stability, because that is where the answers are going to lie. We're looking at foot pressure. We're looking at the ability to create movement at the feet. Because if we just keep stripping tension out at the neck, you're not addressing the underlying problem. So those problems will just get bigger and bigger and bigger until you finally are like, fine, I'll join your 8-week program, Dr. Wishloff, because I can't get a quick release anymore. And that's totally fine. I see people late in the journey usually, because if you have never seen the big picture approach to injury rehab, you think I'm nuts. You're like, why are we talking about my tailbone when my neck hurts and I have a headache? Is because it's connected, right? I know that we want to just go to the site of pain and like touch the site of pain. When people come and see me in clinic, I touch the site of pain so that you don't lose your mind. But ultimately, we're trying to figure out why so much force is flowing there. So we can do some relief stuff there. We can do some blood flow stuff at the site of pain. But we really want to start to map out what is not doing enough. And that stuff that's not doing enough won't be the stuff you perceive from the inside. Got to get out of the problem to see what the problem is. When you're inside and you're just experiencing pain, your brain zooms in to try to just like touch and poke and prod the site of pain. We got to look at why that's happening and how we can create an effective strategy to redistribute force somewhere else, especially when it comes to these types of injuries, postural injuries. They're very different than a traumatic injury. These are getting treated very different because the mechanism that's creating these problems is very different. So that is a quick overview at some of the strategies that I utilize to alleviate pain that is secondary to the result of what you are experiencing at your workplace. If you want to learn more about this and strategies to alleviate pain, I'm going to put a couple of links in the show notes for you to check out. As always, send me a message if you are having any questions or you want me to go into depth on any other topics. I've had a lot of people lately ask me about de Quervain's, tenosynovitis, and carpal tunnel and issues pertaining to the hands. I can certainly do an episode on that. What I would say is start with your breathing, because if your breathing muscles aren't working, your shoulder's not super stable, and then it puts more force into those hands. So I know we talked about breathing in this episode. I want you to start there, even if you're someone listening to this with hand pain. Cool? That is a wrap for this week. I will see you on next week's episode. It was great chatting with you.